recording this session, and I'm hoping that this is okay with everyone. This is just for internal documentation in case if there are any other members who want to access the conversation later. In case if there's an AI note taker that you spot and you find is unfamiliar to you, just let me know, and I can either ask them to take permission or have them get out of this room. To save bandwidth, it'd be great if you turn off your videos at least till the time that we have the presentation from the SRHM Journal, and after that, maybe we can all turn on our videos and see each other for the conversation. Most of us are able to speak in Hindi and English. तो अगर आपके हिंदी में भी सवाल हैं, please हमें उनसे share करें. I'm not sure whether maybe Sapna can clarify whether the journal only accepts entries in English or not. So I'll leave that to Sapna to clarify. For this session, we have about 30 minutes dedicated for Q&A, so there will be some time for that. And while the presentation's on, please feel free to also add your thoughts and questions on the chat section. Here's a quick agenda for today. We're going to spend about less than 10 minutes actually now on introductions, and I'll give you a quick update on the Coordinate Conference and where we're at with it. We'll then give it over to the SRHM Journal, where Dr. Desai as well as Dr. Kismodi from SRHM Journal will take us through both the calls for papers as well as tell us a bit more about the journal. And finally, we'll have some more time for Q&A. Great. So at this point, through this month, we've also been doing more active outreach to the researcher community. We've onboarded a few more organizations, and now we have more than 80 research projects that are submitted to the Coordinate platform. There are over 200 members on Slack now. There's also a series of events that we've been not only attending but also hosting. And as we run up to the conference, it will be very valuable if you're able to also post and update all the work that you've already shared with the network on the web platform. I'd also take this moment to share with you a quick update on the Coordinate Conference that we've been sharing with you a little bit about over the past few weeks. We've now finalized the dates for it. It's going to happen in April 2021. This is organized as 4 days of research, learning, as well as sharing or exchange between the members. And we imagine that this will be a moment for not just members and their supporting foundations to speak with each other, but also to use this as a moment to have a conversation with the wider sort of research uptake community, which includes members in the policy-making community, but also general audiences. And we hope to do this with not just plenary sessions, but also internal workshops, roundtables, and showcases, and so on. Here's a quick look at the agenda as it stands right now. Again, a big caveat that this is all work in progress. But how we imagine this right now is to do this over 2 consecutive weeks. So Wednesday, Thursday on the 7th and 8th of April, and then the following week, Wednesday and Thursday. And every day we hope to have one focal sort of theme that we want to explore. In the first half of the session will be more things that you see would be conversations for community, which include researchers, implementers, and donor community. And they will take the form of roundtables, internal workshops, showcases, and networking. And on the other side, in the afternoon, which is about 4 to 6:30, 7 p.m., we'll have public plenaries where we imagine researchers to be sharing their work and opening up the conversation to a wider policymaking and government sort of stakeholder community. In every day, you can see there's a few sort of headlines that we've identified, and right now we're working on identifying key research outputs that we want to share for each session. And with that, I mean, based on that research synthesized output, there will be a conversation that takes the dialogue forward and gets us to think about what is the future of these questions and how is it that both research and policymaking people are thinking about this. At the moment, for each of these verticals, we have co-anchors that we are working with to detail out and learn more about these issues. But in case if you would independently want to reach out to us and co-anchor any of these pieces, if you feel like there's particular pieces in this that you find interesting or would want to do with another member, please feel free to reach out to anyone from the Coordinate Secretariat, and we'd be very happy to build this conversation with you together. So more updates on this will keep coming to you over the coming weeks. But at the moment, I thought we'd give you a quick timeline for events. 2 weeks from now, we have the next coffee hour, and then another 2 weeks from then, another one. And both of them are going to be around data and its use also in practice. And then we're hoping that we're able to bring together most of what we want to do for the conference by March 25th, which also marks 1 year of the lockdown being announced. And that's when we want to really do the curtain raiser for the conference and take that moment to share not just within the community, but also outside on what are the key themes and issues that collectively as a community of practice we've surfaced in the past year, and then sort of build the next or take the next 2 weeks to build it out as spread the word out in the larger public, and then do the conference in 2 back-to-back weeks. So that's where it's looking at right now. It's very much work in progress, and we'd love for all of you to share your thoughts, comments, and participate in this as we go along. This is coffee hour. You know this format really well, so I'm not going to go into this, and I will dive right into the matter for today, which is really a conversation with the SRHM Journal, and with members. We are trying to sort of learn about what the SRHM Journal does, and 2 calls for papers that they've released. And now I will pass it on to Dr. Sapna Desai and Dr. Eszter Kismodi from SRHM to share with us a little bit more about what they have in mind, and how collectively as a community we can contribute to the journal. Over to Eszter.
Yes, thank you so much. We really appreciate the opportunity to have this conversation with you, and the opportunity to introduce the journal and our 2 issues that are running currently for call for papers, and also talk a little bit about the South Asia initiative that we have, and you may all know about it. So SRHM has been founded in 1994 as a journal, as an organization. From the very beginning, it had a very strong global presence, and one of the co-founder and first co-editor of the journal was from the region, Sundari Ravindram, as all of us know, Sundari, that also Sundari's presence from the very beginning, and other colleagues from the region, always brought a very strong South Asia presence in terms of published articles and readership as well. So SRHM is a journal, but in some way it's different from other journals and other SRHR organizations as well. So the heart of SRHM is a peer-reviewed open access scientific journal, but we are also a knowledge platform that is creating dialogues, conversations, engaging in advocacy, and in our journal and more than a journal activities, we are investing a lot in capacity building that manifests in our mentorship programs that is run by our associate editors and editors, giving a hand to young researchers or those who don't necessarily have the skills and experience to publish in scientific public health journals. For example, lawyers, human rights advocates, policymakers, program managers whose primary preoccupation is not necessarily engagement in academic scientific publishing. The journal itself, as I said, it has a global presence. It's a peer-reviewed journal and it's fully open access. We issue about 3 issues per year, and since we are online only, we restructured in some way our call for papers and how the journal is being run. Before, we had 2 theme issues per year that has been announced, one of them around January and the other one, the call for papers, around June, and the issues were coming out in December and in May. Now the online platform gives us more opportunity to be flexible. We also realize that there is more and more appetite to send articles beyond the announced issues, theme issues. So since 2018, we are running an open issue when we are continuously accepting publications. And we have theme issues and special issues that we are either announcing on the basis of their political programmatic need, or because it's being proposed by a partner based on ongoing research with global values. The uniqueness of the journal that it's paying a lot of attention for multidisciplinarity, global South presence of authorship, and rights-based analysis. The indexing is running on PubMed Central, Medline, Social Sciences Citation Index, Scopus, and others. Our publisher is Taylor and Francis, and our homepage is hosted both by our organization SRHM and also by the publisher Taylor and Francis. We changed the organization structure and management and view about 3 years ago, putting more presence on reaching out to our readers, be more interactive with our authors, also being more present in terms of our More Than a Journal and proactive with our More Than a Journal activities, and creating more communication with our SRHR community globally, and really standing up very clearly that SRHM, and before Reproductive Health Matters, RHM was holding a very strong rights scope. As a result, in the past 2 years, the interest for the journal and for the organization significantly increased. Annually, we publish around 100 articles in the context of about 3 special issues, theme issues, and 1 open issue. That in the past 2 years shows about 130 increase in submissions and 150% increase in published articles between 2018 and 2020. As in the context of our More Than a Journal activities, and also placing the journal in a strong presence of programmatic policy engagement, capacity building, advocacy in the region, we, with the support of Gates Foundation India, we established the South Asia Knowledge Platform. It is our first regional platform. Earlier, as you may know, we had been running 6 or 7 language editions. The language editions, and there was a strong, for 10 years, a strong Hindi language edition of the journal as well. These were really translations of articles. We have our language editors who are selecting articles from the pool of the 100 articles that we are publishing in the given year, and pick those 15, 12 that is more perhaps relevant for the region. We thought that we could do much more than translation and focusing on language matters, but create a much more present, real collaboration with regional activists, scientists, researchers, and other SRHR actors. In the context of this South Asia Knowledge Platform, we have 3 initiatives. One is the establishment of the South Asia SRHM Journal issue, and Sapna will talk about that. We have a mentoring program when we had fellowships, offer 10 fellowships to ongoing, to authors who are intending to write articles, but they either don't have yet the experience or they are struggling how to integrate rights into scientific writing. So this mentoring program is running on a pilot basis, and we hope that it will continue in a more well-established basis next year or the following years with a very clear curricula. And we have a rights-based knowledge creation initiative that you will hear more about later on. When we are with experts from the region and from globally, we are investing programmatically what we mean by rights-based knowledge creation, and we are running several modules investigating the nuances of a rights-based approach, including non-discrimination, accountability, participation, consent, equality, and investigating what the integration of these principles means into research and knowledge creation and writing. Sapna and I would like to talk about the 2 running call for papers that may interest you in terms of submitting publications to the journal. One of them is the self-care interventions and rights-based access issue. It's really addressing a multidisciplinary audience of experts, researchers, policymakers, implementers, and advocates to articulate rights-based considerations relating to self-care interventions. I will talk about what we mean really by self-care interventions in the context of this journal issue. The focus is really on multidisciplinary lens, rights, perspectives. We are expecting from each article that is being submitted to the journal to have a very clear articulated rights focus, addressing the needs and rights of vulnerable populations, whether they are women, marginalized women, transgender populations, those who are belonging to the LGBTI community, those who live in humanitarian settings, or who are facing other type of marginalization, such as disability, or belonging to a particular race or ethnic minority. And we are aiming to strengthen good practices and demonstrate good practices for evidence generation and actions that can improve interventions in this area. This journal issue is being initiated by WHO Sexual and Reproductive Health and Research Department, and it really follows upon their self-care interventions for health guidelines that has been published last year. And their initiative to publish an SRHM issue is really to focus on the rights-based elements and the rights and needs of marginalized, vulnerable populations. It follows upon of a BMJ special issue that also was developed in collaboration with WHO on self-care interventions for sexual and reproductive health and rights, and was published parallel with the publication of the guidelines. In fact, the evidence that was published in the BMJ issue allow the evidence-based for the guidelines themselves. The issues, just highlighting some that has been published in the BMJ issue, includes normative frameworks engaging with the understanding of self-care interventions in humanitarian settings, a cost-benefit analysis, ethnographic studies, connections to climate change, human rights and legal dimensions, perspectives of youth development and engagement, some topical issues, for example, in relation to HPV, the needs and rights of MSM, and also opinion pieces on digital self-care. So I would like to emphasize that this SRHM Journal issue that we are announcing follows upon both on the guidelines and the BMJ issue and other published knowledge in the field, and really calling the attention to rights and vulnerable populations and marginalization. So what does that really mean? We announced some highlights that we are interested in this SRHM issue, but of course the papers can go beyond these particularly highlighted issues. We place the attention on and considerations on participation, non-discrimination, informed health decision-making, consent, coercion, privacy, confidentiality, and accountability, especially articulation on the safeguards that can enhance an evidence-based self-care intervention that is based on human rights. We would like to know more about regulatory and policy frameworks that promote accessibility, affordability, non-discrimination, and have an analysis on the given social, economic, political, and legal context, both in terms of what are the barriers that we know, but also what the enabling factors are. We would like to hear more about community-based strategies that enables access and use of self-care interventions, how adequate information can create an enabling environment. We would like to learn more about privacy that is surrounded with a lot of barriers, but also enabling factors. And we really would like to learn more about accountability measures, addressing various actors who are responsible for effective implementations within and beyond the health system. So this is the scope of the self-care intervention, the self-care special issue. And Sapna will give some more information about submissions and access to the submission platforms. Sapna, over to you.
Thanks, Eszter. Okay, great. Hi, everybody, and thanks for being here. So I'm going to talk to you a bit about the South Asia regional issue and the call for papers. But before I do that, I think I just want to highlight from what you just saw from Eszter is what we have traditionally published in SRHM is we focus in on an issue or a theme like self-care or privatization, universal health coverage. And it tends to be global or across low and middle income settings for the most part, though not always. So one of the big reasons and something we've been talking about at the journal for quite a long time is the need to focus on regions to allow the conversations to be more nuanced vis-a-vis context, to also allow new ideas to come forth that also show sort of regional, I would say threads or issues that might be thematic across the region, but also what differs across countries when you're not looking at context. Because often what happens in our global issues is that you have so many contextual differences that it's difficult to see the threads sometimes. So that was the impetus or the catalyst behind wanting to do a South Asia regional issue. And we really have the opportunity now with the new South Asia regional hub that Eszter has told you about. We have published many issues from the region, I think over 150 over, since the inception of the journal, but we do feel given the the richness of research in the region, we can do much better. So this issue is really an opportunity to do that. As you can see, that's the cover of this issue that has just started publishing articles, but we have a call for papers out now that the deadline is the end of March, so that's still about less than 2 months away. What we're looking for, like every journal issue, are original rights-based articles that can be any type of research, whether it's quantitative or primary or secondary, qualitative research, analytical reviews, commentaries, an individual first-person narrative from activists or practitioners, as well as a real interest area of ours is also cross-country comparisons if people have access to either data or perspectives of that kind. It's really a chance, and I want to emphasize this. I think a lot of you, I'm sure, have, there's tons of research coming out of India. We all know that, and there's lots in SRH. A lot of it tends to be survey-based or, kind of evaluations of interventions. But what we feel when we did a scan of the literature is that, the really critical rights-based analyses and the opportunity to be creative about, or being critical for that matter, on the same issues you may look at. So for example, if it's an analysis of a maternal health program, to take a step back and to look at the laws and policies that surround that, or the issues that may affect the most vulnerable within that, or the lens of non-discrimination, for example. So this is an opportunity to do just that, to issue specific in the region. I'm co-editing the issue with Sundari Ravindran, which has been an absolute pleasure. But I'm going to tell you a bit about the specific call for papers. I'm just going to call attention to the beautiful artwork on our cover by a Pakistani artist named Naiza Khan, who really works with the body and sexuality, which we thought was quite fitting. Oh, Eszter, okay. So the scope of papers, the call for papers is very wide. So unlike self-care, there's no specific technical area. It is wide in terms of what we're interested in. So these are just the basic parameters of interest. So one, I think, category of areas is thinking about determinants around, when you think of structural factors that affect health outcomes, but taking a rights-based lens to them. So for example, issues around consent. Actually, our first paper was around consent and also thinking about age of marriage. Power asymmetries, accountability mechanisms, determinants of SRHR, and those could be economic. Oh, could you go back?
I'm sorry. I don't know what happened. Sorry, just 1 second.
Your mouse is there. It's fine. Thanks. So around the determinants of SRHR, what we're interested in is actually very wide. So for example, issues at the intersection of labor and health, workers, whether it's, informal workers, protections that are provided in formal workers and how those may affect SRHR outcomes, or even access to services. We're also interested in things that look back. So these could be political science or historical analyses as well, whether it's country specific, subnational or regional. Subnational, for example, I'm sure many of you have seen there's this real explosion of subnational analyses in India, in particular, in understanding why states have different outcomes. So this is an opportunity to try to do something like that as well, focused on SRHR. The other next category or bucket of interest is around identity, inclusion and exclusion. So looking around marginalized populations, whether the sex workers, LGBTQI populations, populations that have been historically or more recently marginalized due to cultural, religious, or political identity, for example. But we're also interested in looking at organizing both positively and negatively. When I say that, something like the organization of women's groups, for example, could be a positive, or of women's organizations, of sex workers organizations, is a positive influence on SRHR, but also the negative that we've seen and know quite well around identity, religious identities, whether it's access to contraception or, rules around marriage. We had a really interesting roundtable last month with young people across the region to talk specifically to identity and community politics across their own contexts, across the region. And it was one of the most fascinating conversations I've heard in a long time, because they were young, they were activists, they were practitioners in SRHR across the region, and we're writing it up for this issue, so you'll all see it. But just to give you a sense of the kind of things that have been coming in. The other area that's been quite really neglected, actually, even in SRHM as a journal, and though we have had issues on it, is thinking about, sexual health, SRHR through the life cycle, older men and women. What are the issues, the access to services that affect them? I mean, we've had this real focus on not even the 15 to 49s, let's be honest, it's like the 15 to 30. So it would be nice to see work that considers the issues that face older or people past the reproductive age. Adolescents and young people, though I think in India there's been much more research, that's still an area we'd like to see more critical rights-based lens put to. And the last set of kind of suggested areas are around technology and definitely the equity dimensions, the rights dimensions around different types of technologies and SRHR, and approaches to implementing and delivery. So this could be implementation research, evaluations, but also thinking about approaches in our context, whether it's community health workers, ASHA workers, through community-based groups, whether they're participatory or top-down, and really taking a rights lens to some of the most common implementation mechanisms or delivery mechanisms we see around sexual and reproductive health. And these could be, primary studies, but also could be from the lens of a practitioner, for example. So in short, we're really open to topic areas for this issue. It's much more about the lens in which the papers take. And that's something we also work a lot with authors on. So it's never meant to be intimidating. I remember one of the first papers I ever published was in SRHM. I don't know, this is probably, I think 15 years ago. And Marge, I was quite intimidated by the idea of this, what is this rights-based lens? But it was such an incredible experience to go back and forth and to ensure that a topic that one thought you knew well could be looked at from so many different angles, particularly in the framing of the question and also in how it's discussed. And to Priya's comment, absolutely, we are open. So these are issues here, but please do ask if you're interested in submitting outside of these are very broad, and you're also very welcome to write me or Sundari directly, and we are very happy to engage with ideas. We've been going back and forth with people, for example, on potential topics, even looking at outlines. So unlike other journals, we are really open to engagement. I'd like to say that this issue as well, we're very keen to encourage younger, or not necessarily younger in age, but researchers who don't publish or haven't published a lot, and very happy to ensure that mentorship is provided in bringing articles to publication. So if you could go to the next slide, Eszter. So for both of the issues, self-care and this one, we have 5 types of articles we publish. So it could be a research article, which could be primary, secondary data or analysis, a review article, which tends to be, more, it doesn't have to be systematic review, but an evidence synthesis or a review of laws and policies, for example, on a topic. Commentaries tend to be shorter, but they do need to be evidence-based or drawing from experience, one or the other. Perspectives, again, they're similar, but the perspective articles, depending on the topic, can be more from, the perspective of an individual. And like I mentioned, roundtable, we've done one, and we plan, if anyone has ideas for a roundtable, for example, we'd be really happy to hear them. We are trying to do a second one with abortion providers across the region, for example. But if people have other ideas, the roundtable is really straightforward, where we have a Zoom call where we record and then we transcribe, condense, and then put that out with a commentary. We follow the ICJME authorship criteria, which I'm sure you're all familiar with, but happy to tell you about it in the discussion. We also do have publication waivers for charges for open access if the first author for the South Asia issue is based in the region. Eszter, I'm not sure about the waiver for the self-care. I don't want to give the wrong...
Yes, we have. How the waiver policy works in general for our issues is based on the World Bank classification of countries, low income, middle income, and high income countries. And because it's open access, the burden is on the authors. So low income countries has an automatic waiver. Middle income countries in general, the article cost is about 800 euros. and for high-income countries, 1,600 euros. Because we manage the self-care intervention issue from a funding from CIF, the Child Investment Fund, we have waivers, about 13 waivers for the self-care intervention issue. Clearly, if institutions have the capacity to pay for the author publishing charge, we respectfully ask to do so we can provide the waivers for those who has less ability to provide that amount. The waiver policy is available on the website, and it has to be clearly articulated what kind of waiver is being asked for when the article is being submitted.
Thanks,
If
Eszter.
something is not clear, you can reach back to SRHM editorial team and we can give further advice on that.
And fortunately for the South Asia issue, it's not nearly as complicated as long as the first authors from any of the countries in the region and based there. Could you go to the next slide? So our 2 call for papers are up on our website. You can go to srhm.org and both call for papers in much more detailed form than Eszter and I just gave you are there. And instructions for authors on how to submit are also, there's a link to it from there, as well as on the publisher's website. These are straightforward. And last slide, please, Eszter. And this is our online submission system. Again, it's really straightforward, but if anyone has any issues, Pete, our managing editor, is very, very helpful. So you can always just write directly to him or to us to ask if you have any questions. So I'm going to leave it there and just really encourage anyone who may have interest, whether you're not sure whether it's a fit or not, please do write in. And people always tell me I keep going on about how different of a journal it is, but just to give you an example, we never even reject a paper without at least a page long explaining why, or a paragraph explaining why, and offering authors a chance to really think through the issues again. So it is a journal that really tries to engage with authors' potential and as they go through the process. So please do reach out. And I think we can end there for questions.
Great. Thanks so much, Sapna.
Sure.
I just wanted to thank Eszter and Sapna. This was actually so comprehensive and so enticing. So thank you for taking time and coming to talk to the community. And thanks, Rohan, for hosting. If people are hesitant, please don't be. This is just a space to shoot out anything. Like, if you were ever afraid to ask a question, this is the safest space you can about publishing. These are friends. So please do so, especially as Sapna said, to people who haven't published before but are curious or are intimidated. Ask your question. And also, if you have ideas that you think came out of the CoNet work that you did, which are not kind of strikingly there in what Sapna laid out, you can also say, what about this topic? And then we'll ask Eszter and Sapna to respond. So.
Can I just say something in addition that I think many of you who have great experience in publishing, you may publish your knowledge that you create through research in different journals. So it's possible that you may publish a quantitative analysis in Lancet or BMG or somewhere else. But as SRHM, we also would love to hear possibly a rights-based analysis when you are engaging more on participation, the challenges of participation, how your research methodology intended to include equality and non-discrimination perspectives, how you succeeded and how you failed, or you would like to improve in next time. So we are very much interested in those aspects as well. And as you may see, and nobody shall be offended about it, but usually there are several rounds with the editors, exactly because we are both the reviewers and the editors are encouraging to work to bring out the rights-based perspectives. And my publication also, the first one in a public health journal, I'm a lawyer. I was like, I will never publish again. It was at least 10 rounds with Mark Ferrer. But I learned so much from it, for me as a lawyer, how to publish in a public health journal. So it would be also great, you have such a great network, if you also could encourage advocates whom you come across or work with, or community-based organizations, or lawyers, or human rights advocates, to submit to the journal. We also starting our podcast series, the SRHM podcast series. It will be based on our journal articles, so we will hold conversations about specific journal issues. But our authors also, or readers also expect that we have so limited time to read, but we could listen to articles when we are driving or walking or picking up the kids or whatever we are doing. So we also will actually, there will be SRHM article audios when we are asking authors to read their articles and make them more available. So, and we promote the different journal issues. We very often organize webinars if a fascinating idea is coming out. We do press releases on research articles when the article may have some news relevance. So we engage in the promotion of the articles in many ways. So it's our engagement with the articles doesn't end with the publication, but it's a kind of ongoing process. Do you have any questions or any ideas? We also interested in taking ideas forward that when we could engage in dialogue meetings on specific issues, or for example, for 2022, we are looking for topics that we would like to address. Two topics are coming very strongly, and I don't know, it would be interesting to engage with you what you think. One is on technology and SRHR with strong rights perspective. And the other issue that keeps coming up is climate change and SRHR. So if you have any ideas that what could be the topic that we could promote, would be great. And it would be great to hear from you that, what do you think about the regional issue? Do you feel an appetite to publish in a regional issue compared to a global issue?
So I'm going to call on people if nobody. I know at least, like, I think Vitika and Sushanta are here, and I know they have published with SRHM. So if nobody speaks or asks a question, I may ask either of you to turn your video on and get a conversation started, ask a question or give a comment.
Hi, Priya, this is Vitika.
Thanks.
I can't switch on my video. I'm in the hospital with my mom. She's having a chemo session. So, it's a little bit of a problem for me to be really engaged at this point of time, but I have been listening actively.
Sorry.
No, not at all. Not at all.
Mm-hmm. Okay, thanks, Ritika. So, maybe people are there. Go ahead, Sushant.
Sushant is there.
Yeah, thank you very much. I think this presentation was very comprehensive, and probably everybody will understand that your expectation. And then I was thinking that SRHM already is getting a 360-degree approaches of public health domains, and many new articles I see that is now taking place in SRHM. Your two forthcoming interesting domain is IT, one of them. I'm very pleased, and that will be really, really interesting. And I was thinking that if you can extend this option of IT little more, that how people are utilizing that IT for basically online research, and this many people actually have done research during this COVID pandemic, and different people have taken different innovative approach to reach to the remotest corner of different places. And I think not only in India, in other countries also. Therefore, if we can extend that domain, probably new technology and use of technology for systematic research may be an interesting domain under the IT. That's probably I was thinking. Because qualitative research, many researchers were having a feeling that qualitative research will not happen unless we are getting the normalcy. But people have really utilized very well set methodology and digital technology to capitalize the same thing that they have been doing for face-to-face. I think this kind of experience, if we can even sort small size article, that will be very good for the group and for the future. Thank you very much.
Well, if you all have experience in that, just from recent COVID research, even, I mean, we had a session on ethics and SRHR during the time of COVID, but it would be really, even for this issue, we'd love a perspective or a commentary that, analyzes that experience and thinks about what's great about it and what's been really effective, and also what the issues may be around inclusion, etc., and how those might be bridged. So, I mean, we'd love to see a perspective or a short commentary.
Can
Thank
I?
you. Yeah.
This is Anamika.
Go ahead, Anamika.
Hi. I'm sorry I can't turn on my camera, but I will be sharing. I think Sushant was, first of all, many thanks to Eszter, Sapna, and Priya, everybody. It was really comprehensive and very promising. And I think the idea is really good because people are looking for those opportunities where that could, help them in writing articles properly. And being a teacher, I have seen that students how they struggle. So anyway, coming to the COVID time experience of conducting research, we at C3, we just completed one study that was with elected women representative. And Sushant was really correct. To some extent, it was really an empowering experience even for the women, because face-to-face, sometimes you're hesitant, you're not able to talk, but on phone, I mean, they just opened up. So I think qualitative interview for this particular study was a very interesting and empowering experience. But at the same time, we are doing another study, which is on reproductive health. And we are trying to understand women's access to reproductive health services during the lockdown time and during the COVID, unlocking phase and lockdown phase. So that is a bit challenging because most of these girls are really young. Like by the time they are 25, they are sterilized. So they were not eligible for our research because we were talking to those women who have delivered within a year or two. So for them, it was very difficult to conduct a study on phone. So I think that, if it's elder women, a little bit, confident women who are interacting with people, then digital means can be really interesting, I think. I mean, they can talk to you at their convenience. Sometimes we talked around 8 or 10 in the night, and they were quite enthusiastic. I mean, that was the election time, that was the COVID time, that was flood time in Bihar, but these elected women representatives really participated pretty well. So the reproductive health study is going on, and I think we might have to share something interesting for your journal. But more than that, we are about to begin, it's not a study, but it's kind of a need assessment of marginalized adolescents' sexual health related needs. And we are also going to include the question of identity in it. So, and that will be we'll basically use FGD in Patna maybe. So we have not started yet, but I am quite positive, and I think probably your journal will have the scope and space to, explore opportunity to publish it. So thank you very much. It was really helpful.
Thank you so much. And I think this is, as Sapna advertised, because a lot of people don't know about these roundtable articles. And when it comes to perspectives, I mean, it can be a co-authored article that brings different perspectives together in a very clear line of thinking and analysis. But the roundtable article is also something that can represent a diverse body of work and thinking around a particular issue. And we can share a couple of, one utilization of a roundtable article platform can be when you have a Zoom call, a webinar, a conference, and you bring together. But it's also if, for example, on COVID research, that you want to explore different rights-based perspective, how research during COVID time played out, and maybe bring different marginalized community voices and researchers together, that why technology was an enabling factors to do research and work, SRHR work, whether programmatic and service delivery level was an enabling factors for other, it may created exclusion. So how to bring together different perspectives, the roundtable article piece space can be also a very interesting platform, right, Sapna? I mean,
absolutely, and it takes away the need to maybe structure a formal article, but it allows for, you know, that critical dialogue too. And it's quite interesting. I mean, all of our roundtables, some of them in the past have been some of our most cited, to be honest, because you have everything almost in one space that's synthesized various perspectives. And I think, you know, COVID, but even around adolescence and research on SRH with adolescents is something taking the critical lens to maybe getting a bunch of researchers together with just researchers or practitioners and adolescents, and to ask some of those tough questions. I mean, we want to encourage that space where it is safe to ask the difficult questions.
What you need to pay attention, that it cannot be just a bunch of opinion put together, but it has to have a very clear conceptual framing. Usually what we are suggesting is that the lead author is holding together the different pieces, and you have the questions clearly set for each of the authors or co-authors of one roundtable article piece, that eventually comes together into one conceptual piece. So there has to be some conceptual connection between the roundtable and among the roundtable pieces.
And we would work, if any people have ideas for a roundtable, we'd work together to figure it out, exactly as Eszter just said, before we get a video.
I just wanted to say a couple of words about the mentoring. Usually there has to be a cover letter submitted together at the submission, right, Sapna? And in the cover letter, if there is a younger, unexperienced author, but also if someone never published before because was doing mainly policy and programmatic work and never had an experience in writing, can indicate very clearly that this is the piece of work that I would like to submit. I have limitations. I know that my writing is not fluent. I would like to benefit from the mentoring opportunity of SRHM. So that would be very helpful for the consideration of the article and the need of the author. And very often it happens with us that the ideas, the research is very original, but the writing itself doesn't reach the level of quality that is expected for a peer-reviewed scientific journal. And in that sense, we go back very openly to the author that, look, normally this article, because of the quality of the writing, would be rejected. But would you like to benefit from some mentoring? That means that we will have a couple of rounds of reviews and a little bit more work that would need to be subjected, that your paper would need to be subjected. So in this case, we don't reject, but we are asking for resubmission. And work with the authors.
And Sundar and I are both very committed to this. So for this issue, I mean, like all issues, but we've made it very clear. So we've had a few submissions already where loved the topic, said, oh, okay, and we actually, you know, engaging with the authors even before it goes to reviewers. And we are happy to do that because we really believe in, you know, new voices. This can't be the same, you know, voices that have been writing on SRHR in the region. I mean, the purpose of this was also to have that dialogue between new voices and some of the more established ones. So we are looking forward to that. So if you know others, do spread the word, because it's hard. I mean, people don't necessarily know that about a journal.
I think we finished with the time, so
Yes.
back to
Great.
you, Johan.
Great, thank you. No, we are at time, but in case if anyone who's in the audience has any questions and thoughts, please feel free to share them directly with Sapna or Eszter or through me, and I'm happy to connect you with them for any questions. As this was happening, this was really wonderful to hear. I've shared the link with 3 other friends of mine who are young researchers, and written to them at least twice that this seems really exciting that they're also offering to mentor. So you should not be scared, because 2 of them replied and said, I'm really bad at this. And I'm like, this can't be true. So what I'm going to do is just reach out to more and more young researchers that I know of, and be sharing it with the other members on the Slack. We'd hopefully also be sharing this recording, and we'd make sure that everyone finds out that you're there in case if anyone has questions. But in the meanwhile, thank you very much, Eszter and Sapna, for taking the time to share this with us, to Priya for putting all of this together, and for everyone who's on this call. Yeah, thank you. Thank you for all your time. And this seems like a great opportunity. I want to read what comes out of this now.
Thank
Really
you so much, Roman.
Thank you
really
very much.
appreciate the opportunity of engaging with you, and thank you so much. Thanks a lot.
Thank
Thanks
you
a lot.
so much.
Bye. Bye.
Bye, everyone. Bye-bye.
Great. Thanks so much, Eszter. This was
Thank you so much. We really
lovely.
appreciate, and thanks so much for being so quick and dynamic with the engagement. We so much appreciate, and really thank you.
No, absolutely.
Okay.
Great.
Bye,
Great.
Rohan.
Thank you.
Thank
See you
you.
soon.
Bye-bye.
Bye-bye.